Pelvis is the place where there is the residue of all the sex negativity, all the sexual repression, and everyone in our culture suffers from pelvic anxiety. Now, in addition to the anxiety that is generated when one starts working on this segment, one also sees the secondary layer manifestations of the pelvis, which are the rage and the contempt that the pelvis holds. And it is not by chance that in practically all Western cultures, the expression "fuck you" is the most hateful thing that one can say. Now, the dissolution of armoring. How is armoring dissolved? In psychiatric organotherapy, we employ all conventional modalities. We do talking therapy, we analyze dreams, we use whatever knowledge we have gained from our psychiatric residencies and our psychiatric training. We employ all the intuition that we're capable of and all of the medical art that we're capable of. We try to be as creative as we can because dealing with armoring is a creative process, and every therapist has his own individual methods in addition to what we all do commonly. What we look for is that in each segment the individual be capable of expressing every emotion of which a human being should be capable of expressing. And we also examine to find out areas of hypersensitivity because they always reveal armoring. For example, if you go to touch somebody's flank and they go like this, you know that's an armored area. People shouldn't shrink when you go to touch here or here. So that an area of hypersensitivity reveals the presence of armoring. Now, in dissolving the armoring in the eyes, in addition to what I've already told you about following the lights and looking at objects around the room, patients express every emotion that they can through their eyes. They express anger, they cry, they express fear, they express paranoia, looking out of the side of their eyes. And to some extent, they should even be capable of expressing some degree of psychosis. One of the exercises for people with dissociative disorder is that we tell them to let their eyes go off, as they often do just naturally, and then to sharply refocus on our eyes, to really make contact with our eyes, to let the eyes go off, to sharply refocus, to learn how to bring themselves back from that state when they're not in this world. And we also give them exercises to do at home. We say, when you're walking in the street, look at people coming toward you. See if you can determine the texture of their clothing, all the colors that you can distinguish in what they're wearing. What is the expression on their face? When you walk past a shop window, look at what is displayed in the window, then go back and check and see what you missed. When you're riding in a bus, look at the expressions of your fellow passengers. And what happens very typically is that people come in and they say, I did what you said, I looked at those expressions, and I never saw it before. Everybody is either mad or sad. So these are all things that people learn to do at home, working to make their eyes come more alive. I had a very interesting experience with a schizoid patient. In the beginning of my practice, my treatment room I had no natural light, and it was artificially lit, and after a while I was getting tired of that, so I knocked out an entire wall and put glass brick in the wall. About 6 months after I had put the glass brick in, a patient who had been coming every week said, "Hey, there's something different about this room." And I said, "No, there's not." He said, "Yes, there is." He says, "You didn't used to have that." 6 months later. The oral segment, working on the oral segment. The oral segment usually involves some kind of facial expression. So if a patient is walking around with a bland facial expression, we imitate that facial expression to them. And I have a mirror. I show them what they look like with that blank face. Or if they have a constant smile, we have a session in which I sit there smiling at them as they're smiling at me. Or if there is any emotion revealed in their constant expression, I try to imitate that and demonstrate what they're walking around with. We practice expressing anger by biting. I give them a sheet to bite on, and they try to bite a hole in it, and they practice biting at home on dish towels. And one lady who was practicing biting at home said as she was biting, she said, "I had an image of biting my father's finger." She says, "and I know what that meant." And an interesting fact was that when she had that experience at home, she had always complained of a tightness in her throat. And having had that experience and having integrated it into her consciousness, knowing what that biting of her father's finger image meant, her throat relaxed thereafter. She never had that complaint again. I imitate people's voices. The patients who whine, which is one of the things that drives me crazy, I whine back at them. And, I can do it very well by now, so it drives them crazy. I had an example of another interesting patient. This is a very big man. He's Welsh, and all Welshmen like to sing, and he sings in a chorus, but he talks in a voice that you can hardly hear. And I asked him to sing, and he sings in that big voice. He's got a big chest, but his speaking voice is almost inaudible. So we're working on his voice, and I said, "What do you think it means, the fact that I can hardly hear you speak?" And he says, "I'll tell you." He says, "If I walk into a bar and speak in this voice, somebody can challenge me to a fight." So he had learned that the small voice is safer to walk around with. Then, as I indicated before, on working on the neck, we do a lot of painful stimulation of these tight cervical muscles in order to elicit the anger that is behind the stubbornness, or to elicit the fear that is in these muscles. And sometimes I put my hands around the throat of patients who are obviously walking around afraid of being choked to death. The